Good morning. Good morning. I feel like I owe Kirsten some money, so the check is in the mail. Thank you for this beautiful and wonderful introduction. Dinner on me. So good to see all of you here today. As Kirsten said, this presentation will be shared with you via email afterwards. I'm going to also invite you to make sure you have handy pen and paper to jot some notes down, as I'm going to be giving a lot of book titles and resources for you. Let me also say everything that I discuss in this presentation is under copyright from the publishing company of my book. So please don't steal anything, or else the divine is going to get you from now until eternity, from infinity to beyond. And my publishing company and I will have to sue you. Okay? Is that all right? Okay. All right, let's jump into it. I'm going to share my screen so that you see a PowerPoint presentation, okay? And for the sake of continuity, I'm going to ask that you please jot questions down, and from time to time, I'll pause during this presentation for questions, okay? All right? Okay. I'm going to share my screen now. Can everyone see my screen? Now I'll need somebody to unmute and actually say something.
Yes.
Okay, awesome. Okay, if at any point, if you stop hearing me or you stop seeing my screen, someone please unmute and just holler out, okay? The title of this presentation is Spiritual Care in an Age of Black Lives Matter. Understanding healthcare oppression against African Americans and treating the African American self. When we talk about healthcare oppression, first and foremost, against African Americans in the United States, what do you think of? If you don't mind, a couple of people just unmuting yourself and jumping in.
The history of the Tuskegee report and all of the atrocities that have happened.
Okay.
The incidence of jailing people with mental illness, using jails as a mental illness institution.
Awesome. Yes. Others?
The sterilization of Black women.
Aha. Mm-hmm. Yes.
And the unavailability of health care for individuals who have serious illnesses and could be near death, but insurance is not available to them.
Yes, most definitely. Mm-hmm.
Not believing particularly Black women about pain and the symptoms that they're experiencing.
Yes, thank you.
The inequality and disparity with which the medical system treats Black people.
Yes.
That even if we have access and have insurance, we're treated totally differently.
Right.
We're not taken seriously. The medication, it's just a different standard in the total healthcare system as it stands now.
You're right. Here are, in addition to some stories and incidents and events that you named, here's what I like to call key incidents and experiments. You see these highlighted in blue hyperlinks. These are hyperlinks. So when you receive this presentation via email, just click on those hyperlinks to be taken to some cool YouTube videos and other website links. It's important, first and foremost, when we talk about the history of African-American healthcare in the United States, we must go all the way back to the time of African enslavement. African enslavement that began in this country, January 20th, 1619, is when the first European ships arrived to Jamestown, Virginia, carrying kidnapped African persons, and medical doctors would partner with slave owners to quote unquote inspect African slaves on the auction block. And so we see this mistrust or distrust of our healthcare system by our brothers and sisters of African descent is related all the way back to African enslavement. Then during African enslavement, it's important to note that some of your first medical doctors would work on African enslaved persons without their consent. For example, J. Marion Sims, he's known in our country as being the father of gynecology in the United States. Well, what many people don't know is that he would partner with slave owners and administer experimental perinatal drugs on African slave women for the purpose of breeding or maximizing childbirth. And so this is why a couple of years ago, his name made headlines again, even though he is deceased, because a statue erected in his name, in his honor, in New York was recently torn down, as now more is coming to light on his gruesome, unethical research on the actual bodies of African enslaved women. It's important also to note that research is huge now. Research in the field of spiritual care, research in the field of clinical pastoral education. It's like one of those hot topics, if you will, right now. But African Americans sometimes may have mistrust of research, particularly around mental illness, because of a mental illness condition that was created by medical research and psychologists for diagnosing runaway African slaves. Drapetomania. If you have a moment, you should Google that and research that, drapetomania. You cannot talk about psychiatry, psychology, without talking about drapetomania and the impact of that. Created a mental illness for runaway slaves. Harriet Tubman was known as one who was diagnosed with drapetomania. Nat Turner was known as one who was diagnosed with drapetomania. So when we also talk about why some African Americans have a mistrust of mental health professions like going to therapy and psychology and psychiatry, it is because some of our ancestors have passed down the stories of the ways in which drapetomania was used to diagnose persons who spoke out against African enslavement. Other key incidences include talking about the life of an African-American young lady who died at the age of 31 years old as a result of cancer, and her cells were stolen by a physician at Johns Hopkins Medical Center in New York. Her cells were used to create what we now know as chemotherapy and radiation. Her cells were taken without her permission and extracted without her knowledge by a white doctor at Johns Hopkins University, who then used her cells to create chemotherapy and radiation. She died at 31 after cancer metastasized through her body. Recently, Oprah Winfrey did a movie about the story of her life and how Johns Hopkins had yet to acknowledge what this particular doctor did back in the late 1940s. And so you might have heard this in the news as well. About a year or two ago, Johns Hopkins decided to dedicate the cancer research unit at their hospital in the name of Henrietta Lacks. And so there's a great movie I'm gonna invite you to check out. It's also a book called The Immortal Life of Henrietta Lacks. Her cells continue to be used by the Centers for Disease Control, the CDC today, for medical research, in addition to cancer treatments. Also, it's important to note that many of you have heard probably of the Tuskegee syphilis story, so I'm not going to spend much time talking about that. But it's also important to note that many African Americans have a distrust or mistrust of abortions. Why? Because abortions were created in the United States for the purpose of extinguishing the Black race, according to the creator and founder of what we now know as Planned Parenthood, Margaret Sanger. In 1939, she goes on record to say that originally Planned Parenthood was called the Negro Project. Now we know it as Planned Parenthood. It was originally called the Negro Project. And the reason she founded this organization was because she states that she was afraid about the high rate of African-American childbirths in the 1930s happening in this country. And so she wanted to slow the rate of African-American childbirth down. And so she created the Negro Project. And so many older African-Americans have a distrust of abortions who lived around the time of this Negro Project and somehow believe it is an ulterior motive by the government to slow down the rate of the African-American population in this country. You must know these particular incidents, particularly if you're working as a chaplain in a healthcare institution. Why? Why is it important to know these stories? It is important to know these stories because oftentimes we use a terrible, terrible word. We're working with our African-American patients. We use this word called resistant or non-compliant to medical treatment, sometimes not understanding the ways in which these events historically now play on the psychology of many of our African-American senior elder patients today, and also how these stories have been passed down from generation to generation in many African-American families. And so we must be sensitive to this distrust or mistrust that many African-American persons have as a result of healthcare oppression in the United States. In this conversation, we must also talk about the impact of food oppression. Many of your healthcare challenges today that many African Americans face is as a result of food oppression. Did you know if you were to go to McDonald's.com, you would discover that there are more McDonald's fast food chain restaurants located in poor persons of color neighborhoods rather than European American financially affluent neighborhoods. There are now studies that say food deserts are now a huge issue to contend with in some communities that don't have access to affordable and healthy food and produce and vegetables. All of us in healthcare who are sensitive to issues of oppression say we cannot talk about healthcare oppression without talking about food oppression and food insecurity. And so as chaplains, we must be sensitive to the ways in which food insecurity also impacts persons. So we can't wave our finger at our brothers and sisters who are diabetic and say, why won't you be compliant and eat healthy if access to healthy food is not available in their particular community? How do we become more sensitive to that in our spiritual care role? In this moment, now I move to how to care for African Americans. How to care for African Americans. Before I begin this next portion of our presentation, which is the meat of our presentation today, just want to pause and ask, are there any questions?
Once again, feel free to either unmute yourself to ask a question, or please use the chat box if you have questions or comments along the way.
I'll make a comment based on the food desert and the food access. One thing that I've seen is that this prevalence of fast food restaurants in areas that are dominantly populated by African American persons or people who have other lack of resources, is that it's unhealthy to eat a lot of fast food, but it's often the cheapest alternative. And so it's very difficult to buy expensive fresh vegetables and fruits. And so relying on the dollar, whatever it costs, burger is easier than trying to get the fresh vegetables to prepare.
Most definitely. Most definitely. Yes, yes, yes. Most definitely. Thank you for that. Other thoughts before I move forward?
And you could also make the same argument in terms of why there are so many spirits and alcohol and liquor stores that are side by side and on every block in a lot of predominantly Black neighborhoods as well.
Yes, 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 yes.
There were two
Yes.
comments in the chat about that as well. Christina says, I'm so glad you mentioned food oppression. What is government subsidized is unhealthy. There are more liquor stores in urban areas than produce stands. And someone else concurs and asks, could you speak to the liquor store proliferation in our community?
Most definitely. Yes, yes, yes. If you were to visit the National Office for Substance Abuse Addictions, you would learn that there are geographical locations where places that sell alcoholic beverages are disproportionately placed in low-income persons of color neighborhoods rather than financially affluent communities in suburban areas, and so much research has been written about that. Thank you, everyone. I'm now going to shift to what are the needs of African Americans during in an age of Black Lives Matter. Again, this is copywritten material from my book, Spiritual Care in an Age of Black Lives Matter. I basically state that African American persons during this time have four basic needs to care for the African American self. As you can see, when I say self, that's really an acronym. The S stands for something, the E stands for something, the L stands for something, the F stands for something. And so first and foremost, it's important to care for the social needs of African Americans. The social needs of African Americans. When I speak about social needs, I'm really speaking about two types of social needs. One is personal social needs related to connection. As you are going to provide spiritual care to your African American patients in your healthcare institution or in your community, first and foremost, we have to establish, is this person connected to other people? Does this person have a social support connection, family, friends, religious community, social club, fraternity, sorority, a pet? African psychologist Naeem Akbar says that you must know African Americans are never a differentiated self, right? Murray Bowen, we know him as the father of European American family systems theory. And he says, in life it's important to become self-differentiated, meaning break off from your family of origin, friends, and become different or differentiated from your community by developing your own individual identity. Whereas Naeem Akbar says, but that's not true for people of African descent. African persons and African American persons are never able to fully differentiate from family and from community. Therefore, he says, Murray Bowen got it wrong. We're not supposed to become differentiated selves. We're supposed to become extended selves. He mentions this, writes extensively about this in his book, Know Thyself, that you can get on Amazon. And so it's important to establish connection to discover if your patient or parishioner is alone, and how do you begin to help them find support services or reconnection with family or friends or a community. Number two, we must begin to address communal social justice needs. So when we talk about social needs, it also entails community justice in some sense. How is this person receiving resources around unemployment, poverty? If you're working in the healthcare system, do you make referrals to your social work department? Do you have a sense of personal civic advocacy yourself? As a chaplain, what is the divine calling you to do in your personal time around civic advocacy for persons of color in low economic tax brackets who are forced to deal with unemployment and poverty? If you are a church pastor or clergy, how are you addressing the communal social justice needs of your parishioners? Are you advocating with your local legislative offices, your local politicians around what are resources for persons, parishioners in your community? And so this spiritual care approach not only encompasses an internal personal needs perspective, but it places a lot of emphasis on what's actually happening outside of your hospital as well, and what's happening outside of your church as well. And what is your call to civic advocacy as a chaplain and as a pastoral care provider or spiritual care provider or a clergy person? The E in my SELF acronym stands for emotional needs. Emotional needs. Now, we've all heard of this wonderful feeling wheel by Dr. Gloria Wilcox. Gloria Wilcox is a Christian counselor who came up with this wonderful feeling wheel. On this feeling wheel, you will see 6 words: sad, mad, scared, peaceful, joyful, powerful. And Dr. Gloria Wilcox stated basically all persons experience 6 major feelings: sad, mad, scared, peaceful, joyful, powerful. All persons, regardless of race, ethnicity, sexual orientation, gender, ethnicity, any of that, all persons experience 6 major feelings and what we would call small little baby cousins or relatives to those feelings. And in some sense, she says that these 6 feelings all come from within a person, meaning their own thoughts, their own ideas contribute to their feelings of sad, mad, scared, peaceful, joyful, powerful. And she became groundbreaking many years ago for saying that therapists and chaplains need to work with patients to shift patients from sad, mad, and scared to peaceful, joyful, powerful by helping them work out what are the particular issues from within that they struggle with. What we now know years later in an age of Black Lives Matter is that many of these feelings are not just something from within. These feelings derive from external forces, external factors. And so now the American Psychological Association, APA, suggests we must begin to look at the ways in which people are sad, mad, and scared, not based on their own feelings from within the self, but how sad, mad, and scared is derived from external experiences outside the self. Therefore, we say we're so used to, in spiritual care, addressing intrapersonal issues, meaning the issues that people have within the self. And we don't spend a lot of time addressing the interpersonal emotional needs that persons have. That is the ways in which larger experiences from outside the self have now impacted persons. So no recent research by the APA is suggesting a new term called racial trauma that we must begin to grapple with as therapists, as pastoral counselors, and as chaplains, that our chaplains, that our patients, that our parishioners, that our clients are now faced with. It's even believed now that racial trauma equals PTSD, according now to the DSM-5. Racial trauma can result from major experiences of racism, such as workplace discrimination or hate crimes, or it can be the result of an accumulation of small occurrences that keep happening every day. Microaggressions that keep happening to people every day. We're now starting to wrestle with racism now can cause persons to have I'm going to pause from sharing my screen very quickly. I'm going to pause from sharing this PowerPoint, and I want to bring up a quick image for it in these moments. Can everyone still see this photo?
Yes.
Thank you. We're now discovering, as I said in my PowerPoint, there's an impact of racism on mental health that creates interpersonal emotional needs. So one, we're seeing that African American patients coming into a hospital now in light of George Floyd's murder by four white police officers, that persons now feel disconnected and lonely, second guessing things, decreased hope, increased survival mode, decreased trust, worry, increased risk of depression and anxiety, trauma, existential questioning. How can the world be so cruel? Panic and feelings of powerlessness. I'm going to invite you to check out the Depression Project. The Depression Project. You can check them out on Instagram at Real Depression Project. Again, at Real Depression Project. They also have a website, thedepressionproject.com, I believe. Check them out. They have some wonderful slides for you to think about the ways in which systematic racism impacts what we know Maslow called the hierarchy of needs. And so check this resource out from the Depression Project. And so my encouragement, as you begin to provide pastoral care to persons who have interpersonal emotional needs, what is most helpful in providing spiritual care is to offer, number one, long-term counseling. How do you begin to make referrals to our social services department? How do you begin to, I propose, direct people to checking out psychologytoday.com? How do you begin to make referrals? A long time ago, we used to say in spiritual care field, oh, you know, we're not psychologists, it's taboo, it's unethical. We don't have clinical training as therapists to make referrals. And now we push back on that to say, you know the symptoms and signs as chaplains, as board certified chaplains, you know symptoms and signs of persons who are struggling with trauma. Even if you don't feel comfortable referring them to psychologytoday.com, for example. How do you, when is it appropriate to refer them to the local social worker in your hospital and say, hey, I think this may need a social services consult, or inform the nurse, I think this person may need some psychological services. Also, we're looking at the impact of spirituality by asking the person, how is the divine with you during this time of police brutality, racism, and this whole Black Lives Matter moment. Also, social justice advocacy. How can you begin to empower your patients to participate in social justice advocacy, whatever that looks like for them. That's not for us to make recommendations about what we think they should get involved in, but simply ask them reflective questions around, hey, what kind of justice advocacy work can you participate in? And then last but not least, social support. How do we begin to honor their social support systems and reconnect them, remind them that they are part of a family that loves them and appreciates them? And now I'm going to tell you something that will blow your mind. If you were to click on this spiritual care intervention hyperlink in this PowerPoint, it would take you to another link that says a new spiritual care intervention is actually called cultural pride. Cultural pride in a time of police brutality, racism, in this Black Lives Matter moment. Did you know that people can be redirected to think about pride in their culture as a spiritual care intervention? And so you would ask the person to reflect on, tell me, what are some benefits to being Black? Tell me, what are some assets to you being you? What are some benefits to your African culture? And how do you hold on to that in these moments? How do you allow your African culture to give you encouragement during this time? In this spiritual care approach, the S is for social needs, the E is for emotional needs, and then we come to the L. The L is life meaning and purpose, existential needs. The L means life meaning and purpose. Oftentimes what we've discovered is during times of racism, police brutality, this whole Black Lives Matter moment, people begin to struggle with, wow, what am I called to do? Who am I called to be during this time? There's a lot of existential wrestle around, what is my purpose in life? And so us as chaplains are called to ask our patients to think about, wow, what are you called to be and do? African-American psychologist and theologian, Dr. Lee Butler at Chicago Theological Seminary suggests that, and he's now transferring to Phillips Theological Seminary in Tulsa, Oklahoma, suggests that African-American persons as a result of racism have rage. As chaplains, as therapists, our job is to ask reflective questions that help persons transform their Black rage to Black creativity. And so we can ask them, how are they called to be creative in these moments? What is the divine calling them to create in these moments? Our role as chaplain is to ask these deep reflective questions about their existential existence. And last but not least, the F. The F stands for faith needs or religious needs. The F in this self acronym stands for faith or religious needs. What is this person's transcendent needs or concerns? Have you helped them with maybe faith community notification if they would like? Are they interested in particular religious materials? Are they interested in a visit from their clergy person? Maybe they want sacraments. Maybe they want prayer. That is the final, if you will, that is the final meaning of the F in this acronym. Now, let's have some fun. What do you notice about this acronym? I'm going to say something very, 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 very important. What do you notice about this acronym? Are you with me still? Am I logged out? Did I lose you?
One person in the chat said it can be applied broadly.
Say more. Say more about that.
So the person who wrote that, I don't know if you want to write more about that or if you want to unmute yourself and speak more to that, Anita. And I would say if you're speaking, just introduce yourself, just let us know who you are, just your name and where you're located, just to we build our community. Someone else in the chat box wrote, it's not just on physical needs.
I was going to add also that the self is important because this is really important to view, you know, to really emphasize the importance of selfhood. And it has been the case in our society that African Americans have been othered and they have been dehumanized. And so this is a way to really emphasize the whole self, the spiritual, the religious, the physical, the mental.
Yes. Thank you. Yes, yes, yes.
This spiritual care approach has not addressed the systemic issues in our hospitals and our places of care, how other medical people view African Americans. I'd like to see some advocacy where we work. Even, especially in terms of religious needs, most of us are deeply religious people, and we're quickly judged that we're not intelligent when we make decisions about our care and end of life. There is just so much else in the system that I think as chaplains that we need to model and speak up against.
Yes. So let me take you back to this particular slide. Let me take you back to this particular slide. I believe I mentioned earlier, as chaplains, it is our job to think about what are our commitments to personal civic advocacy. That is our job. That is our job. And simply walking into rooms praying with people. And to challenge chaplains to also be thinking about this conversation, also challenging clergy persons to do more than simply religious rituals, but how do we begin to address some of the systemic sociological issues that African American persons are faced with. Let me point out something if you didn't happen to see it as clearly. One of the things about this self model that I really want all of you all to take away from this presentation is that social needs come first. This approach is linear. This is not an approach where you do the E first or you do the F first and then you do the S last. So it's actually written in order of importance. Social needs are first, emotional needs are second of importance, life meaning and purpose needs are third, faith needs are fourth. Now, I just said something very powerful there. What does that mean to you? What am I saying about where I place quote unquote religious rituals?
Yes. Okay, those last.
Yes, this particular approach suggests that oftentimes the disconnect with us, and I'm going to have a larger conversation around the church, in particular, the Christian church. The disconnect is oftentimes we are more concerned with religious rituals as it relates to Christian rituals, and we ignore or put off or put behind social needs and emotional needs of parishioners. And so this approach specifically challenges chaplains and clergy to be more so concerned about social needs and emotional needs before sacraments, if you will. What else do you notice about this acronym?
It appears to me that we're talking about caring for the whole self, not just one particular area, but the entire, the needs, the total needs of the entire person.
Yes, oftentimes my sadness in chaplaincy and CPE supervision is that we spend so much time focusing on one dimension of care. This model pushes us, challenges us to embrace a holistic approach to care. Thinking about the ways in which person's social needs, emotional needs, life meaning and purpose needs impact their health as well. Yes, yes, yes.
Danielle, this is Kirsten. So I'll bring up a number of things that have been popping up on the chat.
Yes,
So,
I'm sorry. Unfortunately, because I'm sharing my PowerPoint, I can't see the chat.
yeah, so I'll let you know what's here.
Thank you.
A number of people are identifying that what you're offering here should be baseline care that we offer to all patients. You know, that this is something that's good for every kind of a group. So that's one thing. And then another thing is also the way in which this is applicable to the individual patient, but also to community, the community self as well. So those are two themes that are here, and I'll let you respond to those, and then there are a couple other things I want to bring up from the chat.
Yes, thank you so much. Yes, I've done this presentation a million times over the last 2-3 years, and I'll often get a response from people that says, oh, this approach, Danielle, could go to anybody, not just African Americans. My response to that is an invitation around, sometimes I believe the particular social and emotional needs of African Americans is not addressed. And so my hope is, how do I say this? My hope is that as we care for, as we're thinking about caring for African Americans in particular, we stay intentional around looking at the social and emotional needs of African Americans in particular. I'm asking that we not turn this self model into an all lives matter approach, if that makes sense.
Mm-hmm.
But how do we place some intentionality around thinking about the social needs and emotional needs and life meaning and purpose needs of a particular population first,
Mm-hmm.
if that makes sense.
Yes, and someone sort of echoes that by saying, is self, SELF, perhaps a refined hierarchy of needs model specific to the Black community in light of their sociocultural experiences as a group?
Yes.
I think is what you're saying.
Yes, 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 yes.
There's another question here that has to do with, is there in the model, is there a difference between spiritual care with older generations and younger generations? Is this the same model that you would use for different generations?
Yes, this is the same model that I would use. I believe that, and I'm gonna drop my screen. Let me stop sharing my screen for a moment, and let me come back to that. Let me come back to that question. Last but not least, I just want to encourage you to buy my book if you haven't already. It's available. If you're wanting to learn more about this approach, it's available in my book, which is available on Amazon, Stock, Barnes & Noble. And feel free to follow me, send me a friend request on Facebook, or like my Facebook page at Black Care Matters, or go to my website. Okay? Let me stop sharing my screen for a moment, and then I want to open up our conversation for further dialogue. Let me see.
So the other thing that is in here in various forms, Danielle, is that the way in which self relates not only to the individual but to the larger community. So Eric says, what I notice in the acronym, I think of self often in relation to individuals, but much of what you're addressing is communal in nature, such as the contrast between Bowen's differential self and Naeem Akbar's extended self. And that theme is in here a lot in the comments. So I didn't know if there's anything more that you can say about that.
Yes, yes. So I'm also proposing that when we talk about the self as it relates to all Black lives, I'm also wondering, can we be sensitive to the ways in which the self has nuances for particular Black lives? What do I mean by that? There are particular, let me be more specific, there are particular social needs of Black men. There are particular emotional needs of Black men. There are particular existential life meaning and purpose needs of Black men. There are particular religious faith needs of Black men that are different from the particular social needs of Black women, that are different from the particular emotional needs of Black women, that are different from the particular existential life meaning and purpose needs of Black women, and that are different from the particular faith religious needs of Black women. Just like there are particular social needs of Black LGBTQIA persons, and so forth and so on. And so I'm also suggesting in this for us to be sensitive to the particularities in that. I am devastated as a same-gender loving queer Black woman. I am devastated around the ways in which George Floyd was murdered, and 4 police officers have been arrested, and 1 has been charged with second-degree murder charges in these moments. However, the murderers of an African-American EMT worker in Louisville, Kentucky, named Breonna Taylor, still continue to be free. Even though Louisville, Kentucky recently passed legislation saying that no-knock warrants are now considered illegal. But how is it a law is passed in the name of someone and their killer or murderer is still free? Think about that for a second. What are the ways in which all Black lives still don't matter? How are we being sensitive to the lives of our Black transgender community? For example, no one is talking about, as the Human Rights Campaign states, the high rates of Black trans murders that are happening around this country. And we are staying mum and silent on this conversation. Whereas we have no problem with protesting the deaths of Black men who are killed by police. And so there are tons and tons and tons of nuances to this conversation we must also take into consideration. Do all Black disabled lives matter? Do all Black Muslim lives matter? When we talk about ministering to the African American self, this self also has nuances depending on what type of Black life you are as well.
One person in the chat, Danielle, says, I live at the intersection of being Black and gay. I often feel like I have to choose my Black self over my gay self. So it sort of goes to what you were.
Yes,
about the
most
nuance.
definitely. Most definitely. Most definitely.
There was a question, Danielle, about the Black church is so important for many African Americans. Can we really separate faith needs from social needs? Is the question. How do you deal with that?
I say yes. Let's separate them for a couple of reasons. One, sometimes when we keep them deeply connected, one comes to the forefront and one is pushed to the background. And so faith needs, sometimes religious rituals take center stage, whereas social justice issues and social justice needs go in the background, if that makes sense. I'll take a couple of more questions, then I have a couple of more slides to show. Any other pressing questions in these moments? Anything pressing in the chat?
There's one other thing in the chat, but I want to leave space for people if they have something they want to say as well. Kristen and Emily say, I'm struck by the ways that current visitor policies during the pandemic for our hospital, in parentheses, for our hospital, there have been no visitors except in particularly dire cases, are directly in conflict with much of how we provide care for social needs. So the policies are in conflict with much of how we provide care for social needs.
And so I am pushing back on this by also saying another piece of my research is thinking about the ways in which we have to now expand our methodology of spiritual care. What do I mean by that? I spend more time providing spiritual care on Facebook now than I do in real life. I spend more time providing spiritual care via text message than I do in real life in a face-to-face encounter. I spend more time providing spiritual care on Zoom or via FaceTime or Google Hangouts or Microsoft Teams than I do in a face-to-face encounter. And so I'm also asking us to think about what are the ways in which we can use technology during this time of no physical visitors allowed in the hospital. I am encouraging chaplains in these moments to think about how can you use Zoom to allow a patient to have a visitation from their relative by simply contacting the relative, asking if they have an email address where you can forward a Zoom link, and then letting family and friends visit their loved one via Zoom, simply holding an iPad in a hospital room, provided that they're not, unfortunately, not currently wrestling with the COVID-19 virus, but how do you allow them to visit with their loved one via Zoom? There are many hospitals in Chicago that are now allowing some chaplains to provide virtual visits by the chaplains holding an iPad outside of the person's room so that persons can visit their loved one by looking through a glass door of a room. And so this time is also calling us to be very, 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 very creative, if you will, in these moments. Any other questions before I switch gears?
Just one last chat that is affirming that the limitation of guests in the hospital is often in conflict with the way that this person has observed Black families grieve, typically in large groups of family members.
Yeah. All right, now I have a reflective question. Can you say that question real quick in the chat? Something just popped up.
So there's also a question asking, it just came up, what are the ways you'd offer advocacy with ongoing staff training around anti-racism?
All right, let's talk about it. Yes, you're right. You're right.
Might be a whole other lecture.
We're shifting. I don't mind. I got 30 more minutes. Come on, I can shift with you. Okay. paper and pen. I have four reflective exercises for you in these moments. I have four reflective exercises for you in these moments. Number one, using my self-motto approach. Using my self-motto approach, I'm inviting you to think about what are your own social needs? What are your own social needs? And again, social needs in terms of intrapersonal, as well as social needs in terms of communal. How do you work towards justice? How do you work towards advocacy and justice as a chaplain in a healthcare system to see to it that the social needs of African American patients are addressed? So let me give you particular advocacy strategies and interventions. I want to shift now. My presentation is now going to focus on specific types of strategies and interventions. Number one, are you an active presence in your interdisciplinary rounds? What do I mean by active presence? I mean, one, are you going? Number two, where you go? Are you making sure that social justice occurs during these meetings? What do I mean by that? Medical staff start throwing out language around non-compliance. Mrs. Johnson's non-compliant. She won't take any of her diabetic medicine, her insulin. Maybe we're depending on your voice to say, Mrs. Johnson couldn't afford her insulin for this month. Do we have any free samples of insulin we could give to Mrs. Johnson? That is you providing social justice and advocacy as a chaplain. When Dr. Such and Such throws out this term, you know, Mr. Smith is non-compliant. He never wants to take any of his medication. Have you ever thought about, let us examine, where does Mr. Smith live? In light of recent riots in Chicago, maybe all of the Walgreens and CVS's around Mr. Smith's home are closed. So now Mr. Smith doesn't have access to medicines. I'm inviting you to think about these types of questions around advocacy, specifically in your interdisciplinary care rounds. Also, number two, have you ever met with the alderman or alderwoman and council persons around your particular hospital and your particular church or mosque, faith community? Have you ever met with your local politicians and challenged, why do we have so many fast food restaurants located around this hospital, my hospital where I'm a chaplain, or located around this particular faith community? Who is your local council person? Have you ever inquired a sit-down meeting with the president of your institution and said, maybe we need to be petitioning our council persons and our local officials for more medical resources? Why are ventilators at certain hospitals far and few in between, whereas other hospitals have tons of ventilators for COVID-19 patients? Are we petitioning our local governments Are we petitioning our mayor around funding that's allocated for certain hospitals and healthcare institutions in financially affluent neighborhoods versus funding that's not allocated for medical supplies and resources at other hospitals in economically depressed neighborhoods? Did you know if I went to a particular hospital on the south side of Chicago, there is no ventilators? If I was impacted by COVID-19, I'd have to figure out a way to travel to another hospital in another neighborhood if I had COVID-19 and needed a ventilator. Why is that? What are we as clergy and chaplains called to do in terms of advocacy in that way? Emotional needs. Your second reflective question in this is thinking about what are your own interpersonal and intrapersonal emotional needs today. Do you see a therapist? If we are in the helping professions, as spiritual care providers, as pastors, it is so important for us to seek help around our own mental stability. What do I mean by that? What I mean by that is all pastors need a therapist, all chaplains need a therapist, all CP supervisors need a therapist. We cannot expect to help persons with their emotional needs, and we have emotional needs of our own. What are particular resources that we can give? There are 4 important websites that you can give to help African American persons with emotional needs, whether that's you or a patient, parishioner, or client. I recommend these 4 websites. Number 1, psychologytoday.com. Psychologytoday.com. It's a great website. You can place your zip code in a search box on the website and receive all listings of credentialed psychologists in that zip code, along with other resources like what types of insurances they take and any specialties. Next, blacktherapисtrock.com. www.blacktherapисtrock.com. blacktherapistrock.com. This is a particular listing of African American therapists that work with African American persons in particular. blacktherapistrock.com. I'll get to your question in the chat in one moment. Number 3, therapyforblackgirls.com. therapyforblackgirls.com. There are particular resources needed for African American women and girls in particular. Next, particular psychological resources for our Black LGBTQIA persons. Check out the Center on Halsted. The Center on Halsted. You can Google that. This is if you're in the Chicago area.
I'm sorry, I didn't quite get that. Could you spell it, please?
Yes, I'll spell it.
You're breaking up, so I didn't get part of it. Thank you.
I apologize. The Center on Halsted, and the website is centeronhalsted.org. The Center on Halsted. The website is centeronhalstead.org. Has a number of wonderful social and psychological or emotional support resources for African American LGBTQIA persons. The L. The L again is for life, meaning, and purpose. The reflective question that I'd ask you to think about and reflect on is, what are you called to be and do in these moments as a chaplain and as a clergy to meet the needs of African Americans who are wrestling with racism, police brutality, sexism, patriarchy, homophobia, transphobia? What are you called to be and do? What is the divine, whoever you call that divine, called to be, calling you to be and do during this time? And finally, F. The F is for faith needs. What are your own faith needs, religious needs, transcendence needs during this time? How do you minister to the particular faith needs of persons in this moment of African descent who are wrestling with police brutality and racism? I'm going to shift gears again in a moment during the last final moments of our time together. But before I shift to another slide, I want to ask, are there any questions about just what I've said in these moments?
Yeah, just a quick one. We haven't really touched on substance abuse and addiction, and that's a really big issue. And I think it's important and incumbent upon us to recognize that that's another issue for social justice, is making sure that they get the right interventions for either the mental health or the addiction, because that often disproportionately affects the Black community, and they don't always have the resources to get help.
Yes, yes. Thank you. I'd like for you to look at something I'm sharing on the screen and think about, how do you work towards becoming anti-racist? Again, you can take some notes down quickly of what you see on the screen. What are you called to do in particular to address racism right now? What are you called to do? My fifth reflective question for you is, what are you called to do to address anti-racist efforts and become an anti-racist yourself? Any thoughts in these moments?
I've been having these, this is Jana Troutman Miller in Milwaukee. I've been having these discussions with a few people, and for myself, I'm really feeling called to this piece of sitting with my discomfort and thinking about my own mistakes, and but allowing myself to learn from that discomfort and learn from those mistakes. And especially that yielding position of power to others otherwise marginalized, I think is those areas that I'm feeling especially called to right now.
Awesome. Awesome. Thank you. Thank you.
This is Chaplain Brenda Walls. One of the things that I think about is how do I recognize the fact that everyone has implicit biases, including myself. And during this time when there's righteous anger in my mind about some of the things that have happened, to not attach everything to racism. I'm trying to just make myself be equitable in terms of how I deal with situations, and don't, like I said, make everything. Looking at myself, looking at the whole picture, and not becoming that which I hate in others.
Okay. I hear you. I hear you. I hear you.
Danielle, there's a question in the chat box. How
Okay.
do you overcome African American resistance to therapy and counseling? I work in a Black church, and the only people who seek pastoral counseling come for mandated premarital counseling.
I think that the church has a wonderful opportunity. I'm going to give you 5 key important strategies or interventions you can do, particularly in the Black church. Much of this is based on the Black or African American pastor and the lead of the African American pastor. You have tons of resources at your disposal. First and foremost, in the weekly bulletin, are you placing these websites I just named? psychologytoday.com, Therapy for Black Girls, Black Therapists Rock. You can easily place these websites in your bulletin and use your bulletin as a wonderful opportunity to highlight mental health awareness. Number 2, what are you preaching about on mental health awareness? Can I wrestle some theological feathers in these moments without being crucified? Is it safe to say that Apostle Paul struggled with mental illness? Man, everybody went quiet. What are you preaching about in terms of mental illness? Are we preaching ways of love and empathy around mental illness? How can we honor Mental Illness Awareness Month? Did you know October is Mental Illness Awareness Month? Maybe in October, we could invite a therapist or psychologist to come in one day and share resources in honor of mental health awareness. Do we participate in NAMI? Is there a way that you can get a representative from NAMI? NAMI is the National Alliance on Mental Illness, the National Alliance on Mental Illness, to come to your church and give a couple of presentations. The same way we pay associate pastor staff, you ever thought about trying to bring on to the staff a therapist or a psychologist and actually pay them a small stipend to give therapy to church members? These are simple, I believe, solutions of how we can begin to transform this motif. And then what are we preaching about from the pulpit about mental illness? What are we saying in Sunday school about mental illness? What are we saying during Bible study about mental illness? Are we preaching a theology that says mental illness is about the devil taking over your mind? Or are we really preaching about mental illness from a psychological perspective? There's my invitations for you to think about. Any more questions before I switch to another slide real quick? Did I answer your question for the person who raised that in the chat? Yes, no, maybe so. Dwayne, yes, no, maybe so. Okay, thank you. All right, thank you. Last but not least, it's also important for us during this time. I'm going to share one more slide with you. We're also learning that right now it is so important to pay attention to African American children. It's so important to pay attention to African American children during this age of Black Lives Matter. So for persons who are pediatric chaplains, if you're a pediatric chaplain or you're interested in the ways in which we minister to Black children during this time, we're now noticing there is important work to be done around children who suffer from racism, must grapple with the trauma of racism in the childhood that has some difficult manifestations, including fixing others, people pleasing, codependency, external validation needed, living on high alert, fear of abandonment, deprioritizing their own needs, need to improve themselves, tolerates abusive behavior, attracts narcissistic partners, difficulty setting boundaries. There's now so much research now being done on what is going to be these long-term effects, or how these long-term effects are now going to be showing up in the life of children as a result of this police brutality moment. Quick questions. Or thoughts?
Did you say that you would, this is Greg from Des Moines. Did you say that these slides would be available?
Yes. After the presentation.
What are your thoughts about interracial pastoral care, white pastoral care provider for African American care seekers?
In terms of?
Just, wanting to be an advocate and wanting to provide the best pastoral care in terms of the self model and our own self-awareness as white people, living in a soup of racism, and living in a society where whites are privileged on the backs of blacks. So I just wondered, do you have any thoughts about that? I'm actually been working with an African American male who's 30 and really sick, and I just want to know if you had any thoughts about best practices for providing pastoral care when we occupy such different social locations.
I think you can do the self. I think the self can be done by anyone. I don't believe that Black people should just talk to Black people.
Right. I guess it's just a matter of, being sensitive and self-aware.
Yeah, everything I said in the presentation, I'm inviting Black people to do it. I'm inviting white people to do it. I'm inviting Latinx persons to do it. This presentation is not dependent upon a particular person doing the self model. It's my hope that all persons would be invited to initiate these conversations with African American persons in particular. If I could give my personal request, my hope is that more African American, my hope is that more European American white persons were to do this more as pastoral care or spiritual care practitioners and clergy. My challenge in this conversation is oftentimes whenever an incident of racism occurs, we turn to Black people and say, okay, Black people, you all fix it. Everything is fine in my hospital until a Black person who's a patient gets loud. And then all of a sudden, the white doctors and nurses are calling me as the Black chaplain and CPE supervisor to come fix this Black person that's crying really loud. They say, okay, Black chaplain, come fix the Black person that's crying really loud. And so, you know, my invitation is, how do we all become involved? How do we all become involved in this work, especially persons who are non-Black, because I actually think it's more powerful. I believe this presentation would have been even more powerful if there was a white person presenting this exact material. Yeah,
I agree. Sometimes it's I know what you're talking about. It's like, do Black people have to always teach white people?
right. I want to say thank you so much. Thank you for joining. Please get my book. Please go on Amazon, riffandstock.com, Barnes & Noble, and please check out my book if you haven't already. Thank you so much. Thank you so much. I appreciate you. Thank you, Melinda and Russell.
Thank you. It was wonderful.
Thank you.
Thanks everyone for joining. This concludes the webinar. We really appreciate your time. Enjoy your day.
Thanks.